In my persuasive speech, I'll be going over if birth control should be free for everyone. Over half of young adults struggle to afford prescription birth control, despite its critical role in health and autonomy. In this speech, I'll be explaining why birth control should be free. Affordable contraception isn't just a personal issue. It's a societal imperative that impacts on healthcare costs, gender equity, and reproductive freedom. Throughout this speech, I'll be explaining what exactly classifies as birth control, why birth control is important, why birth control should be free, why birth control shouldn't be free, and why birth control isn't free now. Starting off, what exactly is birth control? Birth control, also known as contraception, refers to methods, devices, medications, or behaviors used to prevent pregnancy. It works by either preventing the fertilization of an egg or stopping a fertilized egg from implanting in the uterus. There are several different types of birth control methods. Barrier methods, such as male and female condoms, diaphragms, cervical caps, and contraceptive sponges, physically block sperm from reaching the egg. Hormonal methods, including oral contraceptive pills, patches, vaginal rings, injections, and implants, regulate hormones to prevent ovulations or alter the uterine lining and cervical mucus. Long-acting reversible contraceptives, also known as ARCS, like intrauterine devices, also known as IUDs, and implants, provide effective protection for several years without requiring daily attention. Permanent methods, such as tubal ligation for women and vasectomy for men, are surgical procedures that offer lifelong contraceptives. Natural methods include tracking the menstrual cycle to avoid intercourse during fertile days, also known as fertility awareness, or using withdrawal, pulling out before ejaculation, although these are less reliable. Emergency contraception, such as emergency contraceptive pills or copper IUDs, can be used after unprotected sex to prevent pregnancy. Birth control options vary in effectiveness, cost, side effects, and ease of use. Some methods, like condoms, also protect against sexually transmitted infections, STIs, while others do not. And on this slide, I also have examples of the intrauterine devices, the vaginal ring, the hormonal patch, the hormonal pills, the man condom. Oh my gosh, I'm so sorry. And then the shot. Why is it important? Birth control is critically important for several key reasons. Firstly, it offers numerous health benefits beyond preventing pregnancy. Hormonal contraceptives, such as birth control pills, alleviate menstrual-related issues like painful cramps, heavy bleeding, and irregular cycles. They also treat medical conditions like endometriosis, ovarian cysts, and acne by regulating hormones, and long-term use reduces the risk of ovarian, endometrial, and colorectal cancers. Secondly, access to contraceptive empowers individuals socially and economically by enabling them to pursue education, careers, and financial stability through the ability to delay and space pregnancies. This is particularly impactful for marginalized groups, as unintended pregnancies disproportionately affect those with lower incomes or limited resources. Lastly, birth control supports reproductive autonomy and rights, allowing individuals to make informed decisions about their bodies, relationships, and futures. It promotes bodily autonomy, especially for adolescents and survivors of sexual abuse, while addressing barriers like cultural stigma or lack of healthcare access. Overall, ensuring access to contraception is fundamental to gender equality and human rights. As we know why birth control is important, why should it be free? Birth control should be free for several compelling reasons. First, it improves public health outcomes by reducing unintended pregnancies, unsafe abortions, and maternal mortality rates. Free access allows individuals to manage chronic conditions like endometriosis, like we have previously mentioned, and polycystic ovary syndrome, and it lowers the risk of certain cancers, like we've talked about, specifically ovarian cancer, by up to 50% with long-term use. Secondly, free birth control boosts economic productivity and reduces poverty by enabling people to plan families around career and educational goals, thereby increasing the workforce participation and lifetime earnings. Every dollar invested in contraception saves $7 in public health care and social service costs linked to unintended pregnancies. Thirdly, it addresses systemic inequities by reducing the disparities in access to healthcare, particularly for marginalized communities such as low-income individuals, people of color, and LGBTQ+ populations. For example, Medicaid expansion groups have been linked to 9% drop in births among low-income women, narrowing racial and economic gaps. Lastly, free birth control strengthens societal well-being by allowing individuals to plan pregnancies, resulting in children being born into more stable environments with better access to resources, education, and healthcare. This fosters healthier families, reduces strain on social safety nets, and supports gender equality by enabling women to participate fully in society without being limited by unplanned caregiving responsibilities. However, there are two sides to every coin as to why it shouldn't be free. The case against universally free birth control centers on economical, ethical, and practical concerns. Economically, subsidizing contraceptives for all income levels risks inflating healthcare costs and distorting markets, as pharmaceutical companies may raise prices when free access reduces price sensitivity, disproportionately burdening taxpayers and insurers. Culturally, universal mandates conflict with diverse religious and moral views, prioritizing a contraceptive culture that assumes sexual activity without consequences, while marginalizing groups like LGBTQ+ individuals or those with ethical obligations to contraceptives. Health risks such as hormonal side effects or IUD complications could be exacerbated without tailored medical guidance, and critics warn that easier access might encourage riskier sexual behavior, increasing STI transmission. Additionally, means-tested programs such as Medicaid demonstrate greater efficiency by targeting low-income populations where unintended pregnancies have the highest societal impact, rather than subsidizing middle and upper-class individuals who can afford contraceptives. Redirecting universal funds toward education or cheaper options like copper IUDs could address equity more efficiently. These critics highlight the tensions between cost allocation, cultural pluralism, and health policy design, underscoring the need for nuanced solutions over blanket mandates. Which begs the question, why aren't they free now? Approximately 65% of women aged 15 through 49 globally use some form of contraception, according to recent surveys and data. Birth control is not universally free in the U.S., despite the Affordable Care Act's, or ACA's, mandate due to systemic gaps in policy enforcement, corporate influence, and discriminatory exemptions. While the ACA requires insurers to cover FDA-approved contraceptives without cost-sharing, loopholes allow insurers to deny newer brand-specific methods. An example of this would be the patches or the vaginal rings or specific in certain IUDs if they deem older alternatives to be sufficient, forcing patients into lengthy period of authorization processes and or unexpected out-of-pocket costs. Religious and moral exemptions expanded under the Trump administration enable employers, universities, and even corporations to opt out of coverage, disproportionately affecting low-income workers, students, and marginalized groups. Structural inequities persist as Black women, Medicaid enrollees, and uninsured face higher barriers due to cost, logistical hurdles, or provider bias, such as disproportionate recommendation of long-acting methods to Black and Latinx patients. Political challenges, including ongoing litigation and state-level policies, weaken protections, while inconsistent enforcement leaves patients battling denied claims or surprise bills. Additionally, pharmaceutical companies inflate the prices for newer contraceptives, exploiting the lack of federal price controls. Together, these factors are profit-driven. And with that concludes my speech on whether or not birth control should be free. In this, we have discussed what is birth control, what classifies as birth control, the many different types of birth control, why birth control is important for not only marginalized communities, but for everyone as well, why it should and should not be free, and why exactly isn't it free now.